Good afternoon, and thank you so much for coming to this session after lunch. And just in case you haven't learned my name yet, I'm sure you'll learn it by tomorrow. I'm Natasha Atsopardi-Muscat, and I'm the Director of the Division for Country Health Policies and Health Systems. What's more important today is that I'm standing in for my colleague, Dr. Ledia Lazzeri, who leads our mental health flagship program in Copenhagen and sadly could not be here with us today. And this afternoon, we will be focusing on mental health. And we will particularly look at a case study from Denmark and the anti-stigma program En af os, one of us. And of course, if we talk about patients having a voice and the importance of listening, I think nowhere is this more real than when it comes to mental health, and where we are dealing sometimes with people who are really at very vulnerable stages of their life. And this afternoon, in the next hour, you will hear how this program is helping to break down stigma and actually adding value for patients and for professionals. And the person who has done most of the work behind what you're seeing this afternoon is Jason More from the Mental Health Flagship team, who will be co-moderating the session. Jason, over to you.
Thank you, Natasha. Hello, everyone. My name is Jason Maurer, and I am I'm responsible for the communications and visibility at the Mental Health Flagship for the regional office. And actually, I'm here partly because stigma is in many ways a issue of communication. Prejudice can fill the gaps created by a lack of understanding of somebody's real experiences or a lack of knowledge of how to help. And one of us fills those gaps with understanding and trust. But I don't want to waste any more of your time. I want to let them speak for themselves. And to start with that, we have a short video that we have developed over the past few months with Troels and Anya as co-stars. And once we have shown the video, which is about 4 minutes long, we'll go into talking more with them about their experiences, as well as the development and the benefits of one of us and what it does. So yes, can we please have the video?
Ja, altså at jeg hedder Lulu, og at jeg er 24 år, og at jeg bor i en rigtig lækker lejlighed, og at jeg interesserer mig helt vildt meget for kreativitet og kunst. Altså jeg har borderline-diagnosen. Jeg plejer at sige, at verden lige går under et par gange om dagen. Så der, når andre er i det, de kalder livskrise.
Som psykiatrisk patient på skadestuen i somatikken har jeg følt mig meget lav og meget stigmatiseret, men det er lige så meget min egen selvstigma, der har gjort det. Mest fordi jeg har påført mig selv enten et sår eller har drukket for meget.
The stigma that comes with mental health conditions can have serious consequences for patients. This is especially true for patients visiting an emergency room because of self-harm or because they're experiencing psychosis and are in crisis.
For eksempel kan diskrimination komme til udtryk ved, at man kommer på akutmodtagelsen og har skåret i sig selv, og så er der rigtig mange, der kan berette om at blive syet uden bedøvelse, for eksempel. Ud fra en holdning om, eller en tro på, at patienterne gør det, altså skader sig selv for at få omsorg eller opmærksomhed. Og det er desværre, eller det er slet ikke rigtigt. Tværtimod, så kan det øge de negative følelser, og det kan komme til at provokere endnu mere selvskadende adfærd.
Vi havde, på det tidspunkt var der en overlæge, Ulf Hørlyk, som spontant lavede en video af sig selv om aftenen, efter han havde hørt en af vores ambassadører fortælle. og hvor han fortalte, at han faktisk havde fået en åbenbaring. Og den video delte han jo vidt og bredt.
I går kom der en ung kvinde til os, som jeg så har været læge for under tidligere forløb. Og altid har følt, at jeg har behandlet et godt hjerte. Og da hun så i går kunne fortælle, hvor dårlig jeg egentlig er til at behandle selvskadende unge kvinder, så fik jeg en af de heftigste åbenbaringer i min karriere.
Discrimination in emergency rooms is almost never intentional. Instead, lack of knowledge or training are the main reasons behind it. Suzanne and Marlena recall what it was like before they started to work with the One of Us ambassadors.
Jeg tror, at før vi lærte en af os at kende, så var vi vidste ikke, hvad vi skulle sige til patienterne, når de kom ind. Og vi famlede os mere frem, og
nogen var faktisk sådan næsten, hvor man tænkte, jamen, hvis nu jeg siger sådan her, kan jeg så sætte noget ekstra i gang? Og jeg som leder i afdelingen tænker, altså det er rigtig vigtigt for mig, at vores personale møder dem.
Men for mig var det egentlig en god refleksion, hvor jeg ligesom kunne få lov at gå lidt ind i alt det, jeg havde været igennem, og så selv begynde at lave en selvransagelse omkring det. Og det var faktisk enormt gavnligt for min videre recovery.
The effectiveness of One of Us, together with people's growing awareness of the effects of mental health stigma and discrimination, led the Danish Health Authority to integrate the program into its activities in August 2021.
jeg tror, at vi alle sammen, vi er sygeplejersker og vi er læger, vi har faktisk lyst til at gøre det godt for de her mennesker.
Når jeg er ude og holde oplæg, så bliver jeg bare helt vildt glad for, at de så gerne vil lære, og de vil så gerne forbedre sig. Så det har egentlig bare øget min respekt for og tillid til dem.
I hope you all found that as impactful as I did, and it was a true joy to be able to be involved in the production of that video and to talk with Troels and Anya and their colleagues. So now I have the immense pleasure of introducing both of them. First we have Troels Fluholm Dorp. Troels is an ambassador for One of Us, as you saw. And ambassadors are volunteers who have trained by One of Us in order to tell their stories in a way that helps to break down stigma. Troels has been an ambassador for 8 years, which means he's not only seen One of Us grow from being an independent program, but has become part of the Danish National Health Plan, and he's also seen how attitudes towards mental health conditions have changed in Denmark. And we also have Anya Kareversby. Anya is the National Program Manager for One of Us, and she's been a part of One of Us from its inception and has been a driving force for its scale-up at the national level. Welcome to both of you.
Thank you.
To start with, Troels, as an ambassador, you're an expert at telling your story in a way that helps to break down stigma. We heard a little bit about how it helps you for your recovery. Can I ask you to explain that a little bit more? How does it help you for your recovery, and how does it help your relationship with the doctors and nurses that you work with?
Well, at the point where I joined One of Us was actually because I had a lot of self-stigma and had very low self-esteem and actually didn't want to talk to anyone about my mental problems. So I sought a community of like-minded people where I had the opportunity to speak with them and learn about their story, and I could tell my story, and in that way we could, I could get an insight on how it was to be a person with mental illness or mental problems. And so at that point, I just joined this community, and it helped me a lot. And then I got the opportunity to hold speaks or lectures for doctors and nurses in the somatic emergency rooms. And that was a golden opportunity to tell my experiences, both the bad ones, the negative ones, but also the good and positive ones, the ones where they actually have done something good for me. And that gave the opportunity to start a dialogue with them, and they were very eager to learn about my experiences and their own experiences. And at that point, it was an opportunity to, which is the theme of this conference, that start this transformation and trust, where we help them do better, and as an ambassador, we help the new patients that come into emergency rooms to have better care, so they don't make the same mistakes they did on me. And actually, one of the most positive things I learned from this is that when I think back of one of the best situations is one where they were very caring when I had to get stitches for a cut. And they were very caring and very eager to help me and really calm me down. And because they showed me so much trust, it actually helped me when I got home I wanted to honor that trust. So my self-harm tendencies actually lowered a lot because I kind of felt like I owed them. So that was a point in my recovery process where this dialogue and this way of helping a person with mental problems actually turned out something very positive.
Thank you so much. And building on that, Anya, can you tell me a little about what you notice in health workers specifically, and how one of us benefits them and changes them? At what point do you think, or have you seen, that it starts to click and they start to begin to change their behavior, as well as what motivates them to sustain it?
Well, one of us is built on what in research is called social contact, meaning people with lived experience of mental health conditions who have received training go out and share that experience to different target groups, and therefore also somatic health professionals. And when the ambassadors share their experience, it's never in a time of crisis. So the professionals get to hear what the experience is like for them to come to an emergency room and be in a crisis, and how they experience the behavior of the professionals and what is going on within themselves. So the professionals get to learn from that perspective what it feels like, and that by not living up to the prejudice or the expectations that the professionals may have, those prejudices are broken down, and it creates empathy and trust, and that is the foundation of this transformation that we're working for when we want to end stigma.
Excellent. But I think it's clear from both of your answers that one of us is not just about talking to healthcare providers. It's a lot more than that. And Troels, I wanted to build on your answer a bit, where you've talked about this how it's benefited you personally. But what do you think more broadly it takes to be a good ambassador? You've been an ambassador for 8 years. What kind of support do you need, and what allows you to be the best ambassador you can be?
Well, the first thing is honesty, complete honesty. Be honest in your own story. You are the only world-leading expert in your own story, so you don't need to fabricate something, or you don't need to hide in something that isn't true. So the more honest you are, the better connection you also have with those you have a dialogue with. So that is my absolute best advice, because in this honesty you also get the opportunity to get over your own story as you tell it and kind of get some new reflection on it. And because you have this honesty, the dialogue you have with them you speak to, they have some questions where you sometimes have to go into your own reflection in your own story to find the answer. And that helps a lot in the recovery, because you have to question yourself in something that happened to you. So that was very positive for me, and that's my best advice, to be the best ambassador. When it comes to support, of course you need an organization behind you that supports you, and what one of us did that was very, very good when I started was every time I was out to have a speak or a lecture, there was something from the organization with me. So you had that support that you are not alone. So that kind of gave you the boost to tell your story, because you knew there was always something to catch you if something went bad or you get nervous or something like that. The other support I think I got from one of us was actually the support from the other ambassadors. And that support is very unique, because it's a group of persons who all have some bad and good experiences, and we share those experiences. So we all want the best for each other, and we all want to help each other, and that support is turned into an instant friendship with almost every ambassador. So you get this incredibly support network, very, very large support network. And that kind of gives you the confidence to keep going and keep holding these speaks and lectures and have this self-reflection and get over your own story. And really, it gives you the empowerment you need to get a good recovery.
Thank you. And how, can I ask, does one of us support this community building of ambassadors?
Well, in some very different ways. We have social, what is called? Events, yeah, where you get to meet one another. We go on festivals, we go on different other kinds of events as a big group of ambassadors to speak with a large group of people. And we also talk to each other outside of the work we do in one of us. So you get a lot of friendships very, very quick, and you always know that if you're having a bad day or if you have a downfall or something, you always have a group to catch you who actually understands what it is you're going through. So when you have a relapse, you always have someone who understands you deeply, because they experience the same thing.
Very, very interesting.
And may I add? Also, because the ambassadors organizationally belong to the regional level, and usually in the regions they have something like a monthly or so meeting for ambassadors, and then we try to have an annual gathering as well to create the unity across regional lines.
And Enya, we've talked about what support ambassadors need. But what kind of support does one of us need as an organization? And can you tell us a little bit what it took to get one of us from being an independent organization to being integrated within the Danish Health Authority?
Well, one of us was founded in 2011 by 7 big organizations within the field of mental health. And I think one of the keys was to get all the right organizations on board. And they all agreed that life should be easier for people with a mental health condition. And so I think it was really important that we kept a focus on stigma reduction, even though those 7 organizations disagreed very much on some other areas. And so I think it was key that we kept the focus on stigma reduction. And then as the years went on, we kind of proved how important it was to work with this and that it mattered what we did. So I think the support just increased from those organizations, and they wanted to do something that could promote one of us in the long term. And that more and more pointed to governmental integration. And so, because the Danish Health Authority was always on board since the beginning, they offered it could be there, and everyone agreed that that was a really good idea. So, and now, in last year, the 10-year mental health plan was launched from the Danish Health Authority, and in that, stigma reduction is one of the prioritized areas, so we are part of that now, and that really makes a lot of sense because that increases the possibility of taking an anti-stigma approach in the other parts of the 10-year mental health plan that's not one of us. So it becomes like a principle in the plan.
Thank you. And I want to also ask you, so we've heard a lot today, I think, in the first opening plenaries about innovation, and a lot of that, I think, we tend to think of the digital when it comes to innovation. But I think what Minister Sirkut said that was very, very interesting was that it doesn't have to be. Innovation can also be in ways of working and in ways of communicating with each other. And I wanted to ask you, what do you think makes one of us innovative, and would adding a digital element help?
What makes one of us what?
Innovative.
Oh, innovative. I'm not sure if we are that innovative because other countries have done it before us, but having ambassadors at the heart of everything that we do, that is the absolute key to creating this transformation. So, and there's plenty of evidence that that social contact works. So, we're not the first, but we are definitely at the forefront, I think.
And do you think that social contact works digitally as well? Do you think that because I noticed that you have a toolkit, for example.
Yes.
Can you tell us a little bit about that?
Yeah, we, as part of this intervention in emergency rooms, we have a toolkit where the main themes are self-harm and psychosis, because we found out that the patients with either self-harm or psychosis in the emergency rooms were some of those that the professionals were most uncertain about, and felt that when they had to treat patients with those problems, it went really badly. And so there are like 2 tracks in this toolkit with films with ambassadors, and then at the end there are 3 films that are a little longer with ambassadors, but also Ulf, the doctor in the film, and another nurse discussing very equally different problems within this field.
Thank you. And I think we have time for one more question. Trolls. I believe that it was a speaker earlier today, Rachel, talked a little bit about the little things that health workers can do to improve trust. Can you tell us maybe like one example of that happening for you that really affected your trust, either good or bad?
Yeah, first of all, I would like to say that one of the problems we encountered in our talks with nurses and doctors was they were very, very afraid of doing something wrong or saying something that would make it all worse. And my experience is that you really couldn't say anything or do anything worse. Actually, saying nothing or doing nothing made it worse because you get a little more uncertain about the situation. So the most positive episodes I have in my meeting with the healthcare professionals was very much just kind of treating me like a human being, a normal human being, but with some sensitivities, I would say. So for me, it has always been music. I always have my headphones with me, also today. And they knew that. So they just told me, what is your number? We have a corner for you. Put on your headphones, sit there, quiet, try to calm down, and when it's your turn, we'll come and get you. And that helped immensely, because it kind of gave me this little safe space of my own where I didn't have to always see what was going on in the emergency room and kind of feeling that stress. I could just go into my own little world. And yeah, when it was my turn, they came and got me. It was a very good experience, and I left the emergency room so much better than I have when it was a bad episode.
Thank you so much. So now we're going to move into, because one of the main focuses of this conference as well is trying to take these principles of trust and transformation and bringing them back to your own countries and contexts. And we know that you've been exposed to quite a lot of information, especially not just from this panel, but from the last few plenaries. So to help you in identifying some of these specific points that you might want to reflect on and take back to your countries, we have Ewout van Ginneken, who is the Berlin Hub Coordinator for the European Observatory on Health Systems and Policies, who will offer some reflections on this case study, as well as extract some generalizable points. Ewout, over to you.
Well, thank you very much. And also really thank you very much to be able to talk about such a wonderful program and then see what the generalizable lessons are. So thank you, Anya, thank you, Trolls, for sharing this very powerful initiative with us. As you will see, I will try to, of course, distill some lessons that are useful, I think, for any anti-stigma program, but also for any mental health program. Actually, any delivery reform that you want to do, because you are including all the points that we also see in the evidence, because that's what I'll try to do today. I will show the lessons and also show that there is evidence also from other programs we looked at to show that it works. So I'm basing myself mostly on observations in several European-funded programs that looked at integrated care programs. And it's not so unlike yours, for example. So I will try to focus on 5 of them, but I think there's probably more. So the first was very clearly coming out of your case study, which is engaging stakeholders, gain their trust, and agree on a common path forward. And you do that in the One of Us partnership, which includes various stakeholders. And with them, you reach a shared narrative, you have a common vision, and this really is essential to create trust. And what came very clearly also, for all of you who heard very carefully, is how important investing in communication is. Your monthly meetings and your yearly conference, they are key. And that's also what the evidence supports. So another one is overcoming fragmented leadership and responsibilities. We've seen many implementations fail because...
Not seeing the chain.
Oh, shit. Sorry, excuse me. I need to click because I have my own computer here and it's not connected. Sorry. Yeah, the other one is, are we now in fragmented leadership? Sorry. Overcoming fragmented leadership and responsibilities. We've seen perfect ideas fail because just the responsibilities weren't clearly divided. And in One of Us, there's very strong support, which I think became very clear in how you work together, also even with the National Health Authority, with the national coordinator, with the regional coordinators, in implementation of the program. And actually also the ambassadors provide a really important role in this. So, because what we've seen in other programs is that if you assign leaders, also inspiring leaders, and ambassadors are leaders and inspiring, that really helps the implementation of the process. Also adopting a person-centered and community-based approach. You use the people in the community, you use the people with lived experience of mental illness in the development of your program. And the ambassadors are so much more than just the communicators of the program, they are actually involved with the creation of the program. So this idea of co-creation is something that we see clearly in evidence internationally. Involving people with lived experience, or maybe for chronic diseases, patients themselves, but even their carers. These are really important if you want to implement the program. Also included patient-centeredness in training and adapting health professional curricula. So we talked a little bit about the toolkit that you use to help professionals understand the patient's experience and how to communicate better. providing sensibility training, in fact. I think you talked about it very beautifully. And this is what we need in general, also interprofessional changes into our curricula, that we have a new workforce that knows how to talk to each other and is sensitive to some of these issues. So the last one, not unimportantly, as it also came up, is securing long-term funding as a key to implementation. And I know that integration in the Danish Health Authority, as well as in the 10-year mental plan, put you in a strong position to receive that funding. So if it's not there, they should get funding, because Trolls and Anya shouldn't worry a second about money. They should be worried about what is the next innovation, how do we roll out our program better. We should really support. Did I still on the wrong one? Yes, sorry about that. So that's also what the evidence tells us, that you need long-term contracts, so you have also innovation. Otherwise, you will stifle innovation. Financial security is important. And, wider messages are around pooling the budgets so that it's not coming from all kinds of different sources. That doesn't really help integration or implementation whatsoever. So these are some of the messages coming out of this, and I hope can contribute to the rest of the discussion.
Thank you so much, Ewout. So if it's one thing, I think, that we want you to take away from this session, among many other things, it's that it is possible to set up a program like this, and we want you to have the motivation to do so. So Ewout very, very succinctly put some of the key points that you can bring back to your countries in order to begin that process, if not having already begun so. But you also know best the country contexts that you are involved in. So, and we would like to know a little bit more about that. So we actually have a Slido that we want to have a couple of questions for you to answer in the next few minutes. We'll give you two or so minutes to answer them. So the first one is simply, can you see a program like one of us working in your country? Well, I think we're seeing a very clear answer here. It seems like it is quite possible in most contexts. Then building on that, what do you think are the main barriers and obstacles to implementing a program like One of Us in your country? So we've listed several. Please list as many as you can. I hope I set it up like that. All right.
Oh.
Try now. Very interesting. Yeah, so it's definitely seeming that the biggest obstacle, it seems, is how to get buy-in from policymakers and from the top level, how to get people interested and committed to making change in stigma.
And that's the most important one.
Yeah.
Yeah.
And as we're seeing as well, a through line of this conference, maybe the workforce needs capacity building, needs the skills in order to be able to help, because as Charles and Anya have said, sometimes they do want to help, but sometimes they just don't know how. Very interesting. Okay. So now we are moving on to our second country panel, which I'll ask my co-moderator Natasha to run, and then we'll have a time for audience questions afterwards. Natasha, over to you.
Thank you very much, Jason. And I think our policymakers are coming in right at the right time. Lack of commitment or leadership from policymakers. Are you going to come and take the spot on the stage? We're really lucky to have with us Anniki Lai from Estonia, who is the head of mental health services here in Estonia. Mikhail Okolovsky. Mikhail, up to some time ago, was a former colleague here with us in WHO Country Office Bulgaria. He is now deputy minister and a psychologist, psychotherapist by background. And Catherine Brogan. Catherine is also responsible for mental health services in Ireland, but is here with us today also in her capacity representing Mental Health Europe, a key partner for us in the mental health team as part of the Mental Health Coalition. So, as policymakers, I mean, we've heard again, I've seen trolls on video now, I think, I don't know, maybe 5, 7 times as we were preparing, cutting. I want to remind you all that there's the long, I mean, not very long, it's actually short, but the 10-minute video. And I would really encourage you to watch it if you haven't watched it yet. It's beautiful. But I think today, having Charles and Anya here, you get the sense, no, that there is also behind the organization people like Anya who have been in the background, believing in it, making it work. And now we come, if you wish, to another level or part of the health system where we have the policymakers. So can I start with you, Anniki? I know that mental health is really your passion, very close to your heart. You've obviously watched the video, you've seen the case study. What reflections do you have? And if you think about what's going on in Estonia, is there anything that works, or rather, would you recognize some of the barriers that you have seen coming out from the video and from the conversations that we've been having this afternoon?
Yeah, so many questions, but I will try to address these. First, I'm so lucky I'm one of these who have been to Denmark, and we have heard one of us program directly from our Danish colleagues together with our Latvian and Lithuanian colleagues because we started this cooperation between 3 Baltic state ministries on mental health just last year. Because mental health is quite a new policy area, comprehensive policy area in Estonia at least. So the Department of Mental Health was just established last year. So in that way, we are in a way a startup policymaker department in the ministry at this point, trying to really establish something what has not been existed in a comprehensive policy level. So we are basically building up a system, and reduction of stigma is, of course, one part of it. And talking about barriers, we haven't had any systematic approach until now. We've had some campaigns in Estonia talking about stigma, addressing these issues. But what I've learned also from the Danish example is that you need not only have these short-term initiatives, but you have to think long-term and to establish something what is sustainable. So I think I'm quite committed policymaker here, so trying to be one of these examples. What 70% of people thought that this is actually relevant to make things happen, and it's always like that. And of course, funding is also an issue, and we are always lacking some funds, not all countries, but we certainly do. But this is a matter of prioritization and using the best what you have. I would really love that the government could take the leadership in here, and we could quite soon integrate this way of working into our systems. We are not there yet, so what we start with is we are launching the similar, our version of One of Us in January next year, actually. We are having this strategic partnership with several NGOs who will form a coalition, and they will start this building up our system, building up the system of ambassadors and training them and preparing them. Because one thing what we learned from our Danish colleagues when we went there is first you have to work with stigma continuously because it tends to grow back. And secondly, you have to create a strong support system for those ambassadors that they are not alone. So it takes a little bit of a time. And what I think it's not a barrier, but this is one of the challenges, how to support these voluntary organizations, that they would be sustainable, they would have the capacity they need to sustain these initiatives, and we need to support them as well. So we have to do it together and build this into the policies right away. So we are not leaving the NGOs alone. We have to work together. This is the only way how to do that.
I liked your phrase, we're a startup policy department. I think in a sense that means that you're still very close to the grassroots. May you long remain a startup policy department, always on the look for innovation, but we very much look forward to learning about how this initiative is going and wish you all the best for the launch in the coming weeks. I'm sure you're going to have many questions for our panelists. We should have time to take some questions from the floor. In the big plenaries, time is very, very constrained, but it's in these sessions that we also would like to hear from you. So just make notes until we hear from our other panelists. Michael, I could ask you also what are the barriers that policymakers face, but I'd like you to think about the barriers also that the professionals face when it comes to making these kind of changes and really giving patients more agency, which is going to be the topic of the next plenary this afternoon.
Thank you, Natasha. With regards to the abilities of the professionals to understand the process of stigma, marginalization, discrimination, they need the proper training. Unfortunately, the Bulgarian mental health service provision is very medicalized, and there is a great lack of psychotherapists, psychologists, nurses, social workers. But we try to change this at the moment with the development of the National Strategy for Mental Health, which is well financed. It has a national council consisting of the best professionals in the country, but also of two organizations of people with lived experience. Because from my point of view, most important is to, as also Troels mentioned, is to have their voice, to have their support for everything we are doing. Otherwise, we could turn into a professional discussion among ourselves without the involvement of the patients and their families. And talking about this, you mentioned that I'm also practicing psychotherapist by profession. I loved what Troels said about the authenticity, that if you have the self-confidence to be in front of people, to talk about your own problems, this is not only contributing to the fight against stigma, but is contributing to your own healing process, because the modern psychotherapy is based on full authenticity and to be proud of yourself, to know who you are, etc. So this is, I think, the best approach. From the other point of view, having those patients' organizations, we want to achieve to empower them, because empowerment is the other side of the trust, I think. And because the conference is based on the concept of trust, if we don't empower the people with mental problems, we are not reaching anything. And to be also very concrete, the other important direction we are going in Bulgaria regarding the universal health coverage, because today is this important day, is for the first time in the history of the country to develop clinical pathways for psychiatry. Because until now, the whole budget for the mental health facilities came from the state budget, which means that there could be no transparency, no quality assurance, etc. But if you go through those clinical pathways of the National Health Insurance Fund, then you are sharing the vision that mental health and psychiatry is equal to all other medical disciplines. And this is, I think, very important for a country, for a post-communist country like Bulgaria. And last but not least, I want to mention that on Friday, we have the next meeting of the Mental Health Coalition in Bulgaria, which is part of the Pan-European Mental Health Coalition by WHO. I'm very proud that I have been a staff member of WHO, and now I see the results of the flagship initiative on mental health of your work and of Lydia's and the regional director. So we will welcome at the Ministry of Health the representatives of the WHO, the WR, and the staff of the country office, but also all these people with lived experiences, professionals, etc., to develop the next step of our campaign. By the way, we used a similar video in Bulgaria, the different phases of depression, etc., over the last year. So next year, we can have some inspiration from your video and make the next step. But thank you very much.
Thank you. And I think it's really important what we've just heard, no? That mental health is going to be put on the same footing by being included in the Health Insurance Fund. And also that the Mental Health Coalition is being set up. It's just a little over a year that I was in Sofia with you, and I think so much has happened over the past 12 months. So bon courage, and we're looking forward also to tracking the work that you are doing in Bulgaria. Catherine, as President of Mental Health Europe, you have the oversight of what is happening in a number of countries. We've heard from Denmark, we've heard from Estonia, we've heard from Bulgaria. When you look at the tapestry across the countries, what is your sense? Are patients with lived experience, people with lived experience, really being involved? Is this still patchy? Are we still just having, an example of good practice here and there? Or are we really beginning to see a movement of change and transformation, which is so important, let's face it, also because we know that the mental health workforce is finite. There are shortages. And I was just reading an interesting article this week in The Economist, not a medical article, that was talking about this avalanche or tsunami of mental health conditions and the way in which, because there is so much need out there and we're not really engaging people enough, what is happening is then we end up perhaps crowding out people with really serious conditions that have huge needs, and we're having to dilute our scarce resources and take resources away from those who have huge needs because we have so many with smaller needs. I'd really like to get your thoughts about this.
And I've got 3 minutes. And thank you for giving me the lovely promotion in my job. I work in an NGO. I work as a Deputy CEO at Mental Health Ireland, but we're one of the founding members of Mental Health Europe. But I wanted to start by thanking Troll and Anya and Ewart and also Lulu in her absence and the staff of in the presentation. Please watch the long video. It is actually beautiful because from the perspective of the intended outcome, which was the reduction of stigma, what I saw was, and some people here may be aware of Mary Leamy's work around Chime, and that's what I saw. Your unintended outcomes has been, and Stacey, you alluded to it this morning, around connection. That's where trust starts. that first connection that people make. You're after saying about how you were treated when you went into the ED. The second is hope. If you can't see hope for yourself, and sometimes when you went in, Troll and Lulu, when you spoke in the video, that wasn't there for you. But now, through this program, that hope is the light at the end of the tunnel. Meaning, because people in that service now know what it feels like for a person who experiences mental health challenges, they can now work differently, more meaningfully. And in doing that, can help the person who's attending the ED to uncover what that meaning and purpose for them is in their lives. The identity. You're no longer a set of symptoms. You're no longer a label. You're a person. You're a human being. And you have the same life, as the person who's working with you, with all its ups and downs. And finally, you have the empowerment. So by being treated with respect, underpinning that trust, you're empowered to take control of your life. And indeed, the people working in the service felt empowered because you've educated them, informed them. And through that, it informs the transformation. But most importantly, I think the underpinning piece is equality. So if we look across our countries in Europe, we're all at different starting points. We have an EU comprehensive approach to mental health, which can provide, and it was mentioned a number of times this morning, consistency in how we approach the whole area of mental health. We need to be aspirational if we want to, in what we want to achieve. Not the low base, aim high. I come from a country that in the 50s, we had 22,500 people incarcerated in mental health services. It has taken us a long time, but we now have a cross-departmental and cross-political party commitment to ensuring that change in mental health. We have a Minister for Mental Health, and we have a sharing the vision policy that incorporates the upstream work that is so important, our mental health promotion, our suicide prevention, and then our sharing the vision. At the centre are key principles that I think if we can adopt, all of us across Europe, that it will really, really help with anybody who needs and uses our services. The first is the centrality of service user experience. And that is, and you said it this morning, Stacey, and you said it as well, Trio, it's about you being the importance of what you want in your life. That's what's important. John said this morning about listen, listen, and listen some more. When you spoke, I knew that whoever you linked with had heard what you had to say. And that was, and it's absolutely implicit in having trust in somebody and being able to transform services. The second most important piece is co-creation. We call it co-production in Ireland, but co-creation involving anyone who needs to be involved, service user, family member, supporter, NGOs, government, community and voluntary sector. Involve everybody who needs to be at the table because you all bring a unique expertise that will make the service what it needs to make. Yes, funding is important, resource allocation is important, but having people, community mobilisation and in supporting this will help understand that all of us have a part to play. And then in relation to the centrality of the lived experience, the empowerment organisation commitment. You've heard it time and time again this morning. You saw over 80% of people saying it. It's not just from the government level, it's right down to leaders, to frontline workers, to the person with lived experience, to all of us, ensuring that we play our part. And finally, the last one is learning. What you talked about, making sure that we have the programs in place. Words and language have a huge impact. You attend an A&E department and somebody labels you. You talked about the self-stigma and the external stigma. By having programs like One of Us, what we can see is that that stigma becomes exposed. It reduces. It also impacts on the quality of the service we get, the trust we put in the service, and then us feeling that we have a role as a service user, family member, supporter, worker in the services to make that change. And I think if we stop and look, and from my own experience, I've seen such strength in working together, such amazing outcomes working through co-creation. I'm over 44 years in the business, and I have to say, that has been the most powerful experience of my life, has been involved in co-creation and seeing change being affected. And at the heart of it is a human being. And Maya D'Angelo says, you might forget what I say, you might forget what I do, but you will never ever forget how someone makes you feel. Thank you.
Thank you, Katrin. Thank you to all our panel. And if we can get a mic, this is the time where we want to hear from you now. So, anybody who would like to take the floor?
Hi there, I'm George Valiotis. I'm from the European Health Management Association, and before I worked here, I managed patient organizations. So this topic really touches me. I've watched the 10.5-minute video. It is beautiful. I highly recommend it. And really, I commend you, Jason, for just the bravery that you have in standing up here in front of us, like without your headphones on. Like that's just amazing. So thank you for your generosity with us. My question really for everybody on the panel is, I think about when I was a little boy in Greece, and I would always go to this house across the street, and to get into their house, I had to run through the field. They had a huge pig that would knock me over, and my mother would say to me, oh, you love going there. And I didn't love going there. I would go there because she would make the best biscuits. So my question for you is, if I want the biscuits, where do I go? If I want to make this happen today, who do I need to talk to? What's the actual job title of the person that I need to talk to introduce something like One of Us or whatever in my country? Who do I talk to?
That's a million-dollar question. I think, I don't think I can point to a specific title, but I think you need to get the people who really want to do something. You need to, I don't know if it's a word in English, the fire people.
Firebrand.
Yeah, the people who really will go a long way. And like the doctor Ulf, who filmed himself, he was absolutely essential for opening the door to somatic emergency rooms for One of Us. And some, like Norman Sartorius, he is one of the eggheads in this area, and he talks about getting the people who want to do something, put them in a bus, drive the bus to where you can do something, where there's a door open. And so sometimes it can be a minister of health, sometimes it's a doctor, and I think it's those people who just will keep on working for this.
Thank you. Any more questions, comments over there?
Hello, everyone. My name is Elle-Mall Sadrak. I'm a family doctor in Estonia. I have a question for Denmark. So, in Denmark, we all know that the load of mental health problems is growing every year. The amount of diagnosis given to patients is increasing. What are the 3 best proactive things you do before diagnosing a mental health problem? So today, all panelists are basically talking about reactive work. There's already stigma. How do we prevent stigma? Do you have some programs in schools? Do you have some programs in medical schools for doctors, nurses? And what are the other things you do in Denmark to reduce the number of mental health problems in the future? Thanks.
I think actually working with stigma reduction is good for everyone, not just for people with mental illnesses. Because, for example, in the work market, creating an openness about mental health problems and having a leadership that's very open about this, I think helps the whole workforce or the whole workplace. Because if you make sure to include people who have mental health problems and create an openness around that, it will help others. It will help prevent the development of mental health problems in other colleagues as well, because there will be a tendency towards a more open culture about when you, for example, are experiencing stress, because that's an epidemic as well, which can lead to or develop into serious mental health problems. So if you have this openness, for example, in the workplace, you will empower people to speak up when they need to stop or need support from their leader, for example, if they're overworked and are experiencing stress. And the same goes for example, young people, where it's especially an especially big problem right now in Denmark, mental health problems among young people. And one of us, we go and give talks in schools as well. And I think that helps promote an openness towards talking about your feelings, just healthy feelings, but difficult feelings, so that they will not develop into something that becomes very severe because you feel like you should always appear strong and confident and have this perfect Instagrammable image. So I think more openness in general about the difficult things in life as well. Well, there are some sporadic programs, but they are sporadic. There's not something that all schools do, unfortunately.
But if I might add something, I have two very good examples from my own experience. When I started as an ambassador and was out and gave talks at high schools, when I started, they were kind of adamant to talk about it, and they were kind of silent when we tried to have a dialogue with them, and they didn't actually know how to approach it. What I experienced then was when I was done with my talk and heading home, there always came like 3-4 students and saw me individually because they actually want to talk about their problems. But they didn't want to do it in plenum. They didn't want to do it in front of everyone else. When I'm out and giving lectures at high schools today, it's a whole new world, because actually sometimes they know more about stigma and mental illness than I does. In a way where sometimes before I start the lecture, some of the students actually raises their hand and say, just so I know, there are some of the students in this class who have been self-harming or have this diagnosis, and so, but they don't want to tell you themselves. So I put it upon myself to just mention it, so you can take a little bit tread a little bit careful when you talk about those themes. So I watched this enormous progression already among the young people, and yeah, it's true, there is a lot of problems with mental problems with young people, but I haven't experienced that they today talk about it more openly and without any stigma, and actually trying to help each other. The other example I have is that we just started to work together with our police force, and it was a door that was very hard to kick in, but now we have talks with them, and we have some lectures, and they are all saying that we need to have this in our police academies. Mm-hmm. And actually right now we are working on starting a program in the police academies. So there is some motions we are starting and doing, but the most important part is to keep going through, keep doing them. Don't stop because you just started something. You have to see it to the end.
So, of course, I think what we are seeing is that because of the COVID pandemic, in a way, we always knew there was this dual pandemic, and particularly children and adolescents have really suffered quite significantly, and some of the legacy effects are emerging now. We see this, for example, in the Health Behavior School Children survey. But I think what we're hearing is that because this has become so much more common and prevalent, that people perhaps are talking more about it. Let's see where this leads. I know Michael wanted to say something, and then we have two other speakers from the floor.
And Catherine as well.
I just wanted to complement to the experience in Denmark. Bulgaria has access to the funds of the EU program on recovery and sustainability, and we are introducing now health and mental health education at school in accordance to the age of the children. And I did this by myself for many years, going to schools, and I was witnessing the successful prevention of mental health problems which were arising from the puberty, from love pain, from suicide attempts, etc. And as you rightly mentioned, it's not everything about treatment and rehabilitation, but prevention. And there, I think we should concentrate our efforts, because, as you know, common mental disorders affect about 20% of every society. Anxiety, depression, misuse of drugs. These are preventable diseases. The serious mental disorders like schizophrenia, unfortunately, are not so easy to be prevented, but the burden for the society coming from expenditures for all these serious and widespread diseases can be prevented. Thank you.
I suppose the piece I wanted to add to it was just bringing it up to a little higher, is having mental health across all policies. So we can have programs in schools, and there are some fantastic programs there, but we don't want them ad hoc. We need to focus on, when people think of mental health, they usually go mental illness. But mental health is, we all have it, so we all need to protect it. So we need to move upstream and invest in promotion. Invest in that area of from the cradle literally to the grave. So looking at all those key points across our lifespan. That doesn't just, it's not the business of health alone. It's right across every sector within government. And it's about each government area coming together and agreeing that whatever is happening in mental health, to support the mental health of our populations. Because let's face it, if you have a physical health issue, it's impacting your mental health. So there is no health without mental health, and pushing that piece, which is in the comprehensive approach to mental health in the European Commission, is around mental health being very clearly identified across all our policies. So I think that's where we need to get that piece, where we get the evidence, where we get the buy-in, and stop the ad hoc pieces happening. Although they're very good, let's build the practice, build that kind of stable of good practices, and let them be known and shared.
Mental health is everybody's business is the tagline that we have used to build the Pan-European Mental Health Coalition. And I think we are managing really to break into areas. Ros mentioned the police, but I think more and more we see employers, unions, for example, so going beyond even just schools. Micro?
Okay. Thank you. First of all, many thanks for your presentation. It was very impressive, and one of us is clearly something that goes directly to my heart. My name is Mark Hermans. I'm a child psychiatrist from Belgium. I don't have a question for the presenters and the panel. I have a question for the audience. Whom of you is directly involved in training nurses and doctors? Please raise your hand. That's the elephant in the room and the answer for my question. That's where something should be done. Training in psychiatry, psychotherapy, and mental health in general. All these issues are undervalued enormously in all training programs. Full stop. Thank you.
Thank you. Very important point too, yes. I think we have somebody over here.
Yes, thank you very much for these very interesting discussions, the panel, and also the film with very strong messages. From the European Brain Council, we're based in Brussels, and our work is very close to this topic, focusing on children and adolescents. And as WHO indicated, also 75% of mental disorders start in childhood. So definitely neuroscience has a role to play, and trying to understand how the brain developed during those periods of life. So question for the panel, how do you address the aspect of discontinuity, disruption of care for children and adolescents, and also how to better involve the education sector, particularly on brain health and prevention?
So is your question about disruption at the adolescent phase of treatment? So I think there's this question about disruption when people reach the adolescent phase, the transition. I don't know if anyone would like to respond to that. Michael?
In my previous statement, I already tried to share our experiences with the development of very concrete lessons for the different age groups, especially puberty and puberty children who are really in risk of developing more serious mental health concerns if the environment, family, school environment, etc., is contributing to the feeling of loneliness or vulnerability. So it's crucial, of course, to intervene exactly at that moment. And there are very good examples of good practices all over Europe. I'm familiar with the very good work of the BZGA in Germany, the company for developing health education. In Bulgaria, we also have some pioneers in this way, in this field. What we miss is this systematic programs, because such programs should be developed in all corners of the particular country, not only in the capital or in the big cities, because the most vulnerable groups of children are living exactly in the small villages, small towns, in marginal communities like Roma or migrants, etc. And there we are failing to be sensitive as needed to develop these targeted concepts. In Bulgaria, we were paying attention a lot to the needs of the children coming from the Ukraine, because they were extremely vulnerable with traumata, not only from the war, but also from the separation from their fathers who stayed to fight at the front. And all these fears of loss, loss of relationships to boyfriends, to girlfriends, etc. This is something every country needs to face. And I think these countries which have access to these European funds from the Program on Recovery and Sustainability should make use of those funds, because the children are really the most effective group to work with. Thank you.
Thank you. And it's actually just a few days ago that WHO and the EU have come together on a specific project on the needs of refugees from Ukraine in a number of neighboring countries. I know that Anniki and Catherine wanted to say something, and I think then we just have time perhaps to take out Anya and Troll's last words. Anniki.
Yeah, thank you. I would like to address this question from the side of the prevention. What you, Catherine, mentioned earlier, that we have to work on mental health in all policies. And what regards to children, then we are in Estonia, we have initiated this kind of a quite crazy, but I hope very successful initiative. We have brought together all the ministries from the government, and we have established a working group to find solutions in the area of children and youth mental health, because everybody is talking about that it's worsening every year. And all the countries are troubling with that. And at some point, we can see the data, but we don't know the actual reasons. There is something else what we have to look at. So working with all the sectors, also defense and Ministry of Interior, they all have their roles. The environment, we know that the climate anxiety is there among youth. So this is what we are trying to work on, to really try to establish a kind of a common understanding, common goals, and find some solutions across the all parties of the government.
Thank you.
And
Catherine.
I get upset, and because I grew up probably over 60 years old, and you look at what young people are being told, what they hear in the media, what they see on social media about who they are and what they are, and it's someone else talking about them. So you throw enough mud, it'll stick. So we're seeing young people becoming what is expected and what is being said. I know that in Ireland, our system regarding child and adolescent mental health has got really bad press. And it is, we have a dearth of experience and professionals available to provide the services. Not enough funding was ever given to child and adolescent. We were sinking it into adults, and if we did put it into where it needed it from the cradle, we wouldn't see as much upstream. But the other piece was that in Ireland we did a survey there recently, and we asked young people, how can you access services? And when you do access the service, what does that mean? And when you have 49% of young people coming back and saying, well, what you're offering isn't what I want, then we need to stop and say, whose service are we providing? Whose perspective are we taking on it? And one of the big pieces that I've seen that is beginning to take off, and some of the countries here may have taken off on it as well, is discovery colleges. Again, I come back to, I'm a broken record when it comes to talking about co-production or co-creation, because I think we need to listen to the voice of young people. We need not only to listen, but to have them at the table. We need to have peer support in youth services and family peer support to support the multidisciplinary team in effecting the change that needs to happen in the provision of the services. We're just beginning to set up CAMS hubs within the community where children live, so that we're not taking them away to services that are far away from their home, where you have transport issues, where they have no engagement with who they should be having engagement with, where we're supporting them in their school so that they can stay at school, so that they're not seen as different, and that stigma being self-potentiated again and again. But there is a huge, huge amount of work. It is, I think, the biggest problem that we have in mental health, because if we can sort that, you know, look at the population, it's probably the biggest population we have is our youth. They're our future. They are, you know, I have more years behind me than I have in front of me. So we really need to invest in our children's futures.
Thank you. And I will give to Jason to close, and maybe he can say a couple of words about what they're doing with young people in the coalition too. But Ewart.
Yes. Well, this is
briefly, because we're already over time now.
I'll be very brief, because there was so much richness in the discussion. I've heard so many good points, and I hope you took note. Look, a little bit going back to the implementation gap that we're facing. I think you're alluding to that. We really need to think of how we can have projects like yours implemented, and we need to think about, you know, what is the balance between the help from top down and also have the bottom-up initiative, that you are free with all the people who are interested. That's what you said, the people who are interested to change something. How can, you know, the macro level empower those people to change something? And that's what we need. And I think one key thing, and that was actually my final point, is the point that was made about education and actually training, that it should be an integral part of any medical training. Well, actually more than medical training, police training, probably, you know, the fire as well, schools. So I think there is still lots to do, but these are just some of my takeaways from here. So thank you very much for the very rich discussion.
Thank you, Ewart. Anja, any last thoughts from your end?
Super brief, I will just mention that the next International Stigma Conference will be held in Iceland from the 3rd to the 5th of June next year, and I encourage everyone to come.
Thank you. And of course, Trolls, you get the final word before Jason closes.
Oh, what to say? Thank you, all of you, to showing up and showing interest in this very, very important topic, which is very dear to my heart. So it's very humbling for me to sit up here and see so many interesting people in such an important case. And I just want to thank you all for showing up.
Thank you.
Thank you all for being here with us. It's been a very, very interesting discussion. I've been working with Enya and Trolls for a little while, but I've learned a lot more about them even just in this last hour. Thank you all for being here, and we have a coffee break coming up. We are also, I wanted to say as well, as Natasha pointed out, that we at WHO Europe are trying to work on co-creation a lot more, and we are especially working with young people. Just recently, for example, we released a framework for youth engagement for our Pan-European Mental Health Coalition, which was so popular among the young members that they also wanted then turn it into guidance. So we're hoping to do that next, is creating guidance that can then be used across the European region in meaningfully engaging young people in designing mental health systems that they actually want to use, as Catherine so aptly put it, that they actually see as being something that they would benefit from. So keep an eye on that, and thank you all. Good afternoon.
And a round of applause to our panelists, Jason and Eva. Thank you for joining us. Thank you.